Hello everyone, I am honored to welcome a very special guest today. She is a global authority in public health and a lung disease specialist. Starting in 1992, she has devoted her medical career to helping those affected by tuberculosis, especially in impoverished and vulnerable communities. Over the past 18 years, she has worked with the WHO and the UN. Today we'll be talking to her about her work in TB, the application of technology in healthcare, and of course the impact of the pandemic on healthcare systems. I'm delighted to introduce to you the inspirational Dr. Lucica Ditiu, Executive Director of the Stop TB Partnership. I actually wanted to start out with your personal background. So I read, I was preparing for this session and read about some of your background. I saw some of your videos and I read something, you were a doctor in Romania and then you were working as a journalist and the doctor profession was not enough for you to sort of sustain, right? And you had to you were also working as a journalist. And how did you get into TB? How did you start working on TB and what sort of brought you here?
Yeah, so thank you so much for giving me this opportunity. I come from Romania, actually, from a pretty modest background, my parents, workers in a factory, right? And a very big pride for them. They are both alive somewhere in a village in Romania. For me to become a doctor, but it looked not very easy sometimes to really be able to succeed from a pretty modest family to really achieve to be a doctor in Romania. There was absolutely no intention to go into a certain disease, or even less, I don't think in any heads of anyone in my family and myself, that I will actually leave my country and work abroad. At that time, we were not even during Ceausescu time being able to travel abroad and so on. But and my first travel abroad actually happened almost 10 years after Ceausescu fell in the late 1990s. But basically, I ended up with tuberculosis because I went to do a sort of specialization in lung diseases in the biggest institute for lung diseases and TB in Bucharest, called Marius Nasta. And there, as young doctors, you are doing some work that is not always the most desired by the more senior doctors. And for us was really working with a professor doing a lot of tuberculosis data, basically. It was not the clean, and we were looking over the numbers and trying to analyze. We were having a program in Fox Pro, and we were printing pages and pages of patients and different variables. So we were looking for each of them, what's happening with the treatment. And on top of this, we had patients as well to deal with. And with the patients, I realized that the TB patients spend a lot of time in the hospital. It's like in Romania, the hospitalization was 2 months. And people were feeling fine from the first weeks, and you feel like you should do something with them because they were sitting in the bed, and so it started with understanding a bit more about the people with TB, and then feeling that something more can be done for them. But also, to be honest, a lot of things that drive me even now is an understanding of how difficult it is to come from an affected group or a vulnerable group, how difficult it is to get access to things, even our days. There is a sort of blockage, or there is a sort of barrier. It can be even in yourself, that you feel you are not rich enough, your clothes are not good enough, your status is not good enough, and you don't even push for your own rights to ask. So you prefer to be there modest in a corner, waiting for the doctor or the nurse or a teacher or anyone else to help you. So a lot of those that were the patients with TB in Romania at that time were this kind of people, coming from a very difficult background. And you feel so sorry for them, because I always think, we all had some dreams in life, and people that arrive at an age of, being on a hospital bed with TB, without, family visiting, or, pretty depressed, what is in their soul? What do they think? And how we can support each other, that we make this period for them a bit more bearable. So that's how it started with TB. And then
Okay.
I have also, yeah, and then I had an opportunity to go to my first training abroad in Turkey in 1996, organized by the union, and I really enjoyed it when I started thinking that maybe not clinic is for me, but more public health.
Very interesting. And then, of course, I mean, you sort of worked with the WHO, and then 2011, you ended up setting up Stop TB Partnership, right? So what was, I mean, when you set that up, what were the goals where was TB, where was the understanding of TB in the public health space, and what were the goals that you set for the organization back? It's almost 10 years now, right?
Yeah. It will be 10 years next year, as you rightly say. Actually, Stop TB Partnership as organization started in 2001. In 2011, I joined as executive director of the Stop TB Partnership. You know, what I said at that time, and there is even you know, there was a meeting at the union in which I was invited to give a speech in 2011 summer or 2012, pretty early in this job. And what I spoke at that time, I spoke about people and money. And what I was saying is that in the TB movement in 2011, what was missing the most were two things: money, because money were never enough. In TB, we always had to prioritize. In TB, we were always pretty poor. Doctors dealing with TB, nurses working in TB, people with TB, there is a sort of poverty that we have on us, marked on us, you know, that we never have enough of the money that are needed, and always you have to prioritize and to say, I do this or I do that or I do that, which is fine, but when it's very little, you end up doing actually very little of everything, and it doesn't give the right impact. So money and people. And the people that I referred at that time were the people with TB and advocates and activists, which at that time were very few engaged in TB. We didn't have, you know, communities, networks or TB survivor networks to really drive the efforts to demand the best for them, to demand their rights, to ask for the best treatment. And also we didn't have people from other sectors. So that's what, you know, we didn't have private sector. We didn't have people from, you know, engaged at a very high level from the stakeholders, you know, or the decision makers. So what I was saying at that time, for TB to succeed will be money and people in 2011. And that's what was the diagnosis at that time.
And how, I mean, how have things changed? I mean, from sort of then the last few years, and where are we today? And yeah.
So it's a very good point, because I also thought there will be 10 years next year. So, you know, we will have to have some dialogue on that. I think what I think changed the most in these 10 years is probably the fact that community, civil society, people affected with TB are far more engaged, and are far more in terms of numbers. You know, there are a lot. We actually now have global networks, regional networks. We have country level networks, and even though sometimes might sound like, well, you know, so what? The giving the power of those that are affected and encouraging them to raise their voice for the access to the best tools, irrespective where they come from, irrespective of their color of the skin, irrespective of their religion, gender, you know, poverty level. That's extremely important for a movement, and for making sure that we do the right things. And I think that changed dramatically. I think what also changed is, I say it in a in a way that is not very sophisticated. I think the TB groups or community or people grew balls. I think we are more courageous and ambitious. I think at least my impression was that when I joined, people were a bit shy in demanding more, in saying we can do more, in asking and putting in place plans to address everyone. And I feel that that changed a lot. And I think I would say that we in Stop TB, my colleagues, myself, we were able to encourage people to really have this kind of attitude of I want to do more for my people. You know, even among the TB program managers, even among the ministers of health, there was a bit of a silence on TB and a bit of shyness to bring it up in light. And I think that changed. And the third thing that changed is that there is actually a lot of progress in terms of numbers, lives saved, people that were diagnosed and treated, and we started last year to make a dent finally into the figures in dropping the number of people that are missing with TB and diagnosing more and so on. And it was a pretty good forecast for this year as well, if it was not for COVID. And I know we will probably touch a bit on COVID, but that's what I think changed in these 10 years. Yeah.
Got it. And could you also talk a little bit about what are the different programs that Stop TB has? And I know that you are pioneering the application of technology and the adoption of innovative technologies, and you have these TB Reach programs. But could you talk about what the structure is and what are the types of programs you have at Stop TB, and what are the upcoming programs also?
Yeah. So thank you so much. Yes, we. In Stop TB, we transformed ourselves a lot from 2001 to 2005, 10, 11. Now we are in 2020, we go in 2021. So we are a very dynamic, I call it slim fit organization, mission driven, dedicated obviously to ending TB. And we have our structure basically is, our teams approaching the ending TB mission from different angles. You know very well that we have a global drug facility, which is the larger provider of TB medicines, laboratory tools, and diagnostics for tuberculosis. We are able to provide to domestic with domestic funding and donor funding whatever is needed from the TB catalogs, to say so. We also do the leading work on global TB advocacy and communication. And we have also a very solid team that is the one really supporting communities and also pushing for a TB response to be rights-based, gender-sensitive, and we will go very, very big into social justice and into ensuring that our first recipients, our first partners will be, as of, we already did that, but we will dramatically increase that, will be organizations from the Big South. Through different platforms of funding, like Challenge Facility for Civil Society, and encouraging also national partnerships and platforms at national level in which you bring different partners, including not only stakeholders, parliamentarians, decision makers, but also in technical and civil society, but also celebrities and journalists, a different type of faith leaders, different type of stakeholders that can help us. But in addition to this, we have obviously, and you are more familiar with our TB Reach team, our platform that quickly pilots innovations for scale up. And in the past, we funded projects from ranging from women empowerment approaches to artificial intelligence that, as you know very well, can read chest X-ray. And we are pushing innovations, funding even interventions and tools which are not necessarily WHO recommended, because we are using these technologies, these interventions first time, working very close with our colleagues from WHO to provide evidence for them to say, wow, that works. They will analyze it independently and say this works, so let's recommend it globally. So it's a very, very great collaboration we have. We have the A4I work, which is Accelerator for Impact, working with SMEs and startups, particularly from TB affected countries, to accelerate the rollout of health tech solutions for TB and across diseases. And in this platform, we also partner with an impact investment fund called Bamboo Capital to provide flexible capital to the innovators so that they can further develop their solutions and the necessary technical support to introduce their solution optimally. And we have another part which is called Reimagining Tb Care, another platform that looks in a smart way of how can we revolutionize care in TB affected countries by transforming something that I told you in the beginning, how, when, and where people access care. And simply put, how do we make it as easy as possible for people affected by TB to get the services they need, while facing the daily challenges they have. And the last thing that I want to make is that these are obviously some of the work that we plan to do. I think because, as I told you, we are somehow slim fit, we are able to adjust, and we are pretty flexible to all the challenges and things that are coming up. But of course, we have a very good foundation in our colleagues that are working also with finances, IT, and so on, and we are getting our guidance from our board. So that's how basically Stop TB Partnership works. Yeah.
So one question about technology, right? So in the 2018 UN high-level meeting, leaders endorsed very ambitious TB targets, right? I know that in India, that is, we are aiming to eradicate TB by 2025. And I mean, those are, I mean, I think in general, very ambitious targets. And how do you think technology can play a role in that? And what is, I mean, is technology going to play a big role in solving this problem, or how much of it is, I mean, of course, the communities and private sector, a lot of private sector, public sector, a lot of those have to come together. But what sort of role is technology going to play in that eradication? And do you think those targets are reachable, some of those targets that are currently the targets that are set?
So this is a very good question with a few faces, to say so. And I hope I will not speak too long about it. First of all, about the UN high-level meeting was extremely important meeting, and it was really for us. I probably even myself, even though several colleagues together, far before 2016, we said we need to have a UN high-level meeting. I probably underestimated the power of having a political declaration in your hand and how much can drive the attention of leaders and heads of states and governments, which happened for TB. For me, India is my champion, and I am personally, and I love the drive. I am completely impressed with Prime Minister Modi, that in all occasions at UN, in different regional meetings and nationally, not only this speaks about tuberculosis and the need to end it by 2025, but also let's be very honest that he's putting a lot of additional resources into this, a lot of additional attention. And I'm happy because I think due to his pressure, we see an increase in other heads of states and governments, and I'm particularly impressed with few other high burden countries that are following the example of India in pushing the TB agenda. Now, are the targets reachable? I would say that as of February 2020, I was very positive, very strongly positive, and ready to continue marching as we did in 2018 and 2019. Unfortunately, due to COVID, and as you know, we did all this. We did some modeling, but also you don't need to do any modeling. You just need to put up the hand on the phone and call your colleagues in different high burden countries to understand that basically everyone is terrified because the number of people diagnosed dropped in 2020 significantly. And WHO even officially launched in their report that there will be a significant drop in the number of people diagnosed with TB and possible addition 500,000, 400,000 more people that die this year because of the COVID. So I am afraid that we are kind of pushed back from where we started sometime around to 2015. So we have to continue running to not only arrive where we were in January 2020, but to be where we should be in 2021, which is not easy. Now, we are very excited that we are, you spoke about digital technology and so on, and there are two angles to it. One is we must go ahead and ensure that we embrace digital technologies and artificial intelligence. And I'm happy that Stop TB is incubating and setting a digital technology hub to look at the current and next generation of digital health technologies that what can do in health and specifically in TB. And as you said already, we have been piloting technologies for a while now, even before COVID-19, artificial intelligence for reading chest X-ray, connectivity solutions for health system strengthenings. And we even have our own, it's not anymore our own, it's the world's one, community-led TB monitoring platform called One Impact, which is an app very easy to use, giving the opportunity to communities to really monitor what's happening with the programs, which is really awesome. So we are now moving in a sort of a new stage, trying to pull resources from all over the partnership and from the different teams to try and see how we can make technologies more accessible for implementers everywhere, available to people, especially the most marginalized. But the second piece that I want to say is that what I think we do, we are good at, is trying to discuss with the end users and see what they really want from these technologies, because as you know, there are a lot of debates about data, privacy, and so on. And unless the two parts discuss and understand each other, how they can help each other, the lack of dialogue and understanding is not beneficial. So we are doing that quite a lot. So to go back very briefly to what you said, I think using the digital technology and artificial intelligence in TB is crucial, and we should be very agile to jump over the usual lengthy periods to take on these technologies and to just go and use it when it's available and not wait years and years before we go to the implementation.
Great. So I think, it's a very interesting point about bringing this technology to implementers, right? And I think also making it available. One of the things that has happened recently, I think last week, was WHO issued a guidance, actually rapid communication on the use of AI technologies to interpret chest X-rays, and they found that AI can be alternative to human readers for chest X-rays. Now, I know that Stop TB has played a role in getting this guidance out, and wanted to understand what role you played. And this happened very quickly in a very short period of time, and it was surprisingly quick. So I think, kudos to Stop TB and WHO in getting this done, but also wanted to understand what role you played and how sort of this came about.
Yeah, so thank you so much. I want to say that we are, for the last few years, 2 years, 3 years, working extremely close with our colleagues in WHO in many areas. It's a perfect synchronization, and I think I speak for both sides. We feel extremely comfortable, in not only supporting each other but pushing agenda in the same direction together. So this rapid communication that was issued is the first of its kind that recommends the use of AI in medical diagnosis. And obviously it shows that artificial intelligence approaches can expand the screening and triage of TB identified through medical imaging approaches. For sure, the software can help overcome the shortage that we have globally of radiologists. The figures are terrifying when you look at the need for radiologists and what is available. And to make that happen, of course, there were others engaged, but from our side, TB Reach has been piloting AI diagnostics in Zambia since 2012. Can you believe it? 2012, 8 years. So we were the pioneers introducing AI in 11 different countries, rural communities, in slums, migrant populations, and more. And for example, last year, TB Reach started, looking and, encouraging introduction of artificial intelligence on X-ray machines, which are really small, and so all these projects, all the experience and the data and publications were presented to the WHO GDG this summer. And there was a very good interaction, and that's what contributed, together with other factors, to the guidance that WHO issues on artificial intelligence now last week. This is what I was referring to, what TB Reach does. in some situations are testing new ways of delivering care. In some situations is really testing different tools, different approaches that then, if seen useful, WHO can consider for further recommendation or global recommendation and so on. So that's in a sort of nutshell the AI story.
Amazing. Thank you so much for sharing that. So coming to, I mean, you spoke very briefly about the COVID-19 pandemic, right, and the impact on TB. And definitely that impact has been mostly negative. But do you also think that, I mean, when we are, I mean, like, for example, the way people are, I mean, socially distancing right now, or the way people are maintaining hygiene, or the sanitization that is required, I mean, everywhere, is that going to help TB also? And I mean, what are your top learnings from this pandemic? Are there, I mean, so COVID-19, of course, again, I mean, I think TB was primarily a poor man's disease in some ways, right? It was mostly the low and middle income countries who were burdened by it, but COVID has hit everybody, right? And so what are the key learnings for this TB community from this pandemic, and what do we take forward which can help both TB and COVID-19?
Yeah, so first of all, one thing that you mentioned in the, thank you for this. I think we all are learning a lot with this COVID on personal life, on our own lives. 2020 is a difficult year, and I want to say first and foremost that for all of us, you know, social media says let 2020 pass. I'm looking for 2021, which will be so amazing. Hopefully will be, but let's be very realistic that it's not that on you know 2nd of January COVID disappeared, we are all back on the streets, everything is fine, because it will not be. It will take time. So for everyone that thinks that it will be done once the calendar date is changed, forget about it. But you asked, the first point was around will the mask and social distancing help? I think it will help with the transmission. You know, if it TB transmission happened in workspaces, workplaces, you know, we didn't have too much transmission happening in like if you take a taxi, for example, or a bus, unless it's a long drive, right? If it's a bus driving for 8 hours is a different story. I think this kind, in terms of this kind of impact and transmission, it will be less there, but it will be much more in the households because we stay much more together. If we are several of us in the same household and somebody has TB and symptoms with difficulties in accessing care, very few people are really going to get tested or to access the clinic. So what I expect to see, obviously, is an increase of TB in the households. And that's why one of the very important things that we should do in 2021 is give preventive treatment to the contacts of a case in the household and children as well, in order to ensure that we don't have a huge number of people with TB coming out of the houses and families and living together after this year. There are more things to say in terms of the epidemiology and the impact on that, but I know our time is short, so I want to go with the key learnings. And I think there are 3 key learnings, if I may say. So one is the bitter one, and the bitter one is how fragile our achievements are, not just in TB, in everything. As I told you, we are rolled back to basically year of 2015 in like this, okay, because of the numbers being dropped in terms of cases diagnosed and treatment and so on. But in addition to that, I think a lot was lost in terms of rights of people, in terms of understanding stigma, in terms of constructing systems that are really able to embrace and provide care to everyone, including or especially starting with the most vulnerable. In this kind of situation, you realize that what is constructed in most of the countries is not able to do that. It's the same thing of me first between countries, but also within countries. And the ones that are the most vulnerable are always somewhere in the back and trying to go somewhere as well, but very difficult. So the first lesson for me was the fact that our progress can be undone. The second, unexpectedly and very quickly. But now moving to the two more uplifting learnings. One is a very serious one, which is that COVID showed that it's possible to do a lot of things that we spoke for so many years in tuberculosis, and we never, we always thought it's not possible. You see, it's possible to get together as countries to push for a rapid diagnosis. It's possible to get millions and millions of dollars mobilized to be available to address COVID. It's possible to have a vaccine in 10 months and to start deploying it in less than a year. It's possible to have hundreds of tools to be, diagnosis in the pipeline, and it's possible to get the funding. It's possible to have live data for COVID every single day from every single country by gender, by age group. In TB, not just in TB, in other diseases as well, we work with 1-year-old data, and in a lot of places we still use the paper, and we are making our interventions and programs based on last year's data, okay? If on the television screen will appear not just the COVID map, but the map of TB or maybe other diseases as well, immediately we will understand much better which are our priorities and where a government should look to keep their people healthy. So all the things that we thought, oh my goodness, would be so nice, but it will take us years and so on, COVID showed us that it's possible if there is a will. So from now on, we cannot accept any be a different standard than was for COVID. If a vaccine was ready to be done in 10 months for COVID, I don't understand why our time frame is like, we hope to have something in 2028 for tuberculosis. And the third one is something that is kind of linking both of us here, is the fact that I personally think technology, digital technology, really has helped the TB response through COVID-19. And I think countries that were able to really go quickly into using any type of artificial intelligence, adherence tools, were able, which are not needed just for TB, but for any chronic treatment, long-term treatment, and as well being in a smart way using integrated platforms to bring them closer to the people, even if it's in a vehicle. You put in a vehicle, digital X-ray and rapid molecular tests, and you put some tests for HIV, cardiovascular, diabetes. You move the mobile thing, you do the tests, you use AI to transmit the data to somebody reading them, and you are doing a fantastic job. So I think the future will stay there, and it showed to us that we should be more proactive and more rapid in implementing digital technology. And for me, that was I would say a third positive lesson of the COVID situation. So I'll stop here because I can speak till tomorrow, but
no, I think very valid insights, and I think absolutely digital technology is here to stay. I had a follow-up question on the second point that you made, right, about mobilizing the resources. I mean, while for COVID, we were able to mobilize resources because the affected countries were very different for COVID, right? Do you think we'll be able to mobilize the same kinds of resources for TB going forward, or do you think it will fall back to where it was earlier, like pre-COVID? And so that's
yeah. Yes, it's a very good point. So what I want to say is that you see COVID and TB in 1 year killed the same number of people, but obviously COVID got all the attention, and obviously it's an acute, very clear type of symptomatology, but still in terms of life lost, we are almost the same. TB and COVID, and in the countries, the low-income countries, actually TB kills more than COVID, and that's what you're absolutely right, that the COVID funding came so quickly because it posed a threat to the big north, to say so, to other type of people, but the ones that come from a more high-income countries, and that's why the mobilization of resources was completely different than what happened for TB. Basically, we have this with TB. I said in another interview the other day that TB was here with us. COVID comes like a tsunami. It will, hopefully we will be able to end it, but TB will remain, and if anything will go up. And that's because it affects, as you rightly said, people from different parts of the world. We launched a report called Deadly Divide, and it was speaking between the deadly divide between commitments of people or commitments of the UN high-level meeting and targets and what was achieved. But there is a deadly divide in the world between the big north and the south. However, why I am positive is that's what I said, that's what gives me hope, is that COVID showed it's possible. So if we have a really good community of people affected by TB and civil society demanding the same speed, the same accuracy, the same attention for TB, it will be possible to do. We just need to be very vocal and very strong for the disease that it kills us, and it's also airborne and also very cost efficient to diagnose and treat. It will not be easy because, as you said, we will always have to face this different approach, and the fact that TB is still perceived as not my issue here, for example, even here in Switzerland. But I think that if we are able to put in motion the energy and the ambition and the strong voice of those affected from every single country, I think we should be able to mobilize resources and attention for TB as well, very much so, yes.
And one last question for you around COVID and TB, right? So this is, I was reading about, I was looking at some of your past videos, and you spoke, I think several years back, about the stigma of TB, right? And which was there, the stigma of being a TB patient, having TB and interacting with people when you have TB, right? I think that there is that stigma, and then I know that Stop TB and other organizations have done a lot of work in removing that stigma and making the situation way better than it was maybe about 10, 15 years ago. But how do you see that happening with COVID? Today there is a stigma of having COVID, right? If you are COVID positive, it is obviously something which there is a stigma associated with it. Interactions, you have to quarantine and all that. Do you see some of the similar things that happened with TB also happening with COVID around the stigma? And what are your thoughts on that? I just wanted to hear your thoughts on the stigma of having TB versus the stigma of having COVID.
Yesterday, I actually had an interaction with a TB survivor and an amazing activist from US, Kate, and her kids. And she was telling me that there is a stigma for TB, for COVID. Now there is a big stigma for any type of cough. When you cough, everyone is like running away from you. And there are 2-3 things that I want to say there. That's one of the things that I told you about being so quickly undone. You work to really change the mentality of people that TB should not be a stigmatizing disease and so on. And then suddenly you have COVID with similar symptoms and so on that adds to that stigma. We need to be mindful of that. Now, we are encouraging very much 2 things. One is we have a lot of survivors that are really very well trained and went through a lot of stigma, how to address stigma, how to understand, how to measure stigma, and how to make that interventions are not stigmatizing. So we encourage that they will put their efforts into addressing this with COVID. And we also, as Stop TB, with other partners, Global Fund and USAID and KNCV, have a set of tools to really look at how much stigma people are facing in TB. It's very easy to adapt that for COVID as well. It's not very TB specific to say so. In understanding that and then having a set of measures to put in place to address this. It will be a long time to do that because it requests a lot of intensive and sustained communication. But because of COVID, I expect to be some funding available for this. We should build in using this for TB as well for any type of cough and so on. It is rooted into people's understanding and so on. Even in my own country, I am infected with TB. So I have friends that are, I'm not sick, but I'm infected. And I have people telling me when I was starting coughing the other day, saying, okay, stop, because now we don't know, is it COVID or is it TB that you have? So you just go away. So even people that I know and are my friends and I expect are educated are having this kind of reaction. So I imagine how it is to be for people that are coming from different backgrounds and feeling the same type of push. It's not easy to take, but I think we have an entire area of work on stigma in the Stop TB. And we are planning together with our partners from Challenge Facility, civil society, especially in the high impact TB countries, a lot of work on stigma that is TB, but it is very easily expanded to COVID as well.
Got it. Well, thank you so much, Lucica. I don't have any other questions for you.
Qure.ai is a successful example and of an amazing startup. But I know that things can look like honey and milk, but they are not honey and milk. So I wanted to see if you had any critical challenges as a startup that you faced and maybe you continue facing in bringing innovative technologies to TB.
Absolutely. That's a great question, Lucica. And I think the first point there is that a lot of times, I mean, startups like ours, right, we don't focus on problems like TB. And for whatever reason, because we were in India and I mean, I have seen TB and a lot of our team members have seen TB firsthand, we thought of TB. I mean, but when we initially started Qure, the focus was on interpreting chest X-rays, being able to detect all kinds of findings on chest X-rays. And that has always been our focus. But then we realized that, see, this technology can actually be used to screen for TB as well. And that is how we sort of started working on in the TB space. And I mean, I think finding that space itself was something which was by chance. I mean, we never sort of said, okay, we want to go out and solve TB. It sort of happened by chance because we were exposed to so many people who had TB and we felt like this could be something that we can work on. And that was the first part. I think the second part is that when you look at TB, right, I mean, it's a global disease. It's across a lot of these low and middle income countries. And when you take a solution like Qure and you're trying to get it to these countries, one of the challenges is around how do you sell these solutions? How do you make these solutions available in those countries? How do you sensitize people about these technologies, right? Because I mean, being in India, it's very hard for us to sort of sensitize somebody in Africa about how an AI interpretation of X-rays could help them run their TB program better, make their TB program more efficient. So for us, I mean, that was one challenge. And I can say that I think Stop TB has played a significant role in getting us there, because I think what Stop TB has done is take on these new technologies. For example, one of our first deployments was part of a TB Reach program in the central part of India, in Nagpur. And that was one of our first deployments on TB, and we started Stop TB, evaluated this technology, found that to be relevant in the detection of TB on chest X-rays, and then followed by, of course, a microbiological test, either a TrueNat or a GeneXpert. And Stop TB also has done a lot of work around evaluating these technologies, right? So when you look at evaluating our chest X-ray algorithm as compared to radiologists, I mean, Stop TB, Jigen and Jacob as well have published papers which show that the X-ray technology that we have called QXR is comparable or even better than human readers at interpreting X-rays and detecting TB on the X-rays, and also comparing these technologies with other technologies that are available around the world. So I think that reach was a challenge, but Stop TB has solved that sort of reach problem, because now working with TB Reach programs, we are in many different countries. Through Stop TB, we are through part of the A4I collaboration or through the TB Reach programs, we are in multiple locations. Stop TB has had webinars about the AI solutions where our technology has been showcased, and we have seen people from different parts of the world become aware of this technology. And then, of course, awareness is the first step, and then typically they want to evaluate and then move on to actually adopting the technology.
I think you also mentioned that very often we don't think about the TB space, you know, so that's my other point that I wanted to pick your brain or to ask your question was, what in your opinion needs to be done to really catalyze, or how to say in my language, push more innovators and innovations for TB, particularly for from startups? what should we do to get attention of people for tuberculosis to push innovations in the TB space?
I think, I mean, one thing which you mentioned earlier on our talk about this collaboration with Bamboo Capital and the fund that you're creating, that is a very, very significant step, because a lot of startups are looking for funding and they, I mean, especially if you have a startup which is only focused on TB, you might not get venture capital funding and you may not grow. I mean, so if you are, you start small and then because you're not getting funded, you might choose to move to another disease or maybe focus on some other technology and not necessarily work on TB. And I think this kind of a funding setup where a Bamboo Capital and a Stop TB coming together to fund startups which are in the TB space will definitely help get more startups in this space, number one. I think second is also around A4I. I mean, I also feel like the kinds of programs that you have created to propagate this technology across multiple countries. That is important because finally, even when investors come in, my investors, I'm investors at Qure, they are looking for a revenue growth. Finally, it's a commercial organization. We are not a non-profit organization. So we have to show revenues, we have to show profits. And I think the role that Stop TB is playing in bringing these technologies to different parts of the world and getting that adoption and getting that revenue is very helpful because again, that is critical. So I think, I mean, funding, getting access to more funding, number one, is important. Number two is getting access to a broader set of customers, increased revenue, increased traction. That is the second thing. And I think the third thing, which is also a function of second, is how do you promote these technologies, right? So again, promoting these kinds of technologies and promoting the use of AI for TB. I think what we are seeing now is that, especially with all of the work that we are doing in TB, we have seen a lot of people talking about AI in TB, and there are many more companies that are now getting interested in working on TB. So I think if we can promote the kinds of companies that are already invested into this space and make them superstars, I mean, sort of, then you will see more people sort of following their path, right? So I think that's sort of what I feel, that we have to create these stars in TB and make it feel like, yeah, this is a global problem. This is not just a low and middle income country problem. This is a global problem. We have to solve it. And there is enough funding to solve this problem. We just have to have good players who want to come and start helping us. So once we create that, I think a lot of people will follow.
I think I just wanted to say that it's great that we had this opportunity to interact together and that I hope we can look towards 2021 with hope. So that's all.
Same here, look forward to 2021. And I hear your advice that January 2nd, 2021 will not mean that everything is back to normal. So we'll have to take it as it comes, but look forward to working together. We are very thankful for the contribution that Stop TB has made in our growth to date, and look forward to working with you even more going forward. Thank you so much. Thank you so much for your time today.
Thank you so much.